right, 53 degrees right now. We have rain showers, partly sunny, though, ahead today. And it's going to be hot. They're saying 85 degrees. And I had to do kind of double check that this morning. I was literally did a head turn. I was like, wait a minute. Did that just say 85? That's what they're saying. 80 yesterday in the Champlain Valley. Kind of broke some records. Stray shower or maybe even a brief thunderstorm tonight. We'll get down to about 67. Heard some thunder this morning. And then tomorrow, Tuesday, looks good. Mostly cloudy skies and 86. I say it looks good because the temperature looks fantastic. Wednesday, rain to start, sun to finish around 77 for the daytime high. And then Thursday, cooling down significantly. Mostly sunny, but only around 60 degrees. Quick heads up, if you're coming through Barrie today, the major water and sewer upgrades are taking place for the Washington Street and Spalding Street intersection starting today. Started at 7 a.m. We'll go through Friday afternoon, the 22nd. Here's what you need to know. The westbound traffic on Washington Street going to be stopped at Academy Street and detour down Academy to Eastern Ave. Eastbound traffic is going to remain on Washington Street, but you should expect some lane shifts and some delays. All traffic on Spalding Street will need to enter and exit using Perry Street during the construction. So plan ahead, be patient, exercise some cautious driving in the area, and just go easy. Bikers for Beth yesterday, a huge success. What a weekend it was. The sun was shining. It was windy. It was dry. It was just amazing. My guest this morning, Beth Sightler, who is the CEO of Washington County Mental Health Services, who is probably right up there with my list of some of the busiest people I know. And I want to thank you so much for coming in here, Beth. It's been a while. Last time you were in here, we were just chatting, was when Mary was in here.
Yeah. When she and I were still transitioning. So
Wow.
it's been
a little
almost
while.
2 years. Yeah,
You are so busy with everything. Frankly, I don't know how you do it. There is so much going on at Washington County Mental Health these days. Where do we begin?
It's an exciting time.
Yeah, it
there's
is.
a lot going on.
There's some really, really cool things that are happening. And big news about the Granite Shed co-location project.
Yeah.
Can you talk about that?
Yeah, I'd love to. First of all, thanks a lot for having me on. It's nice to see you again, not just in the hallways, but here. It's good to get back in the studio.
I always see you. We're always like, hey.
Waving through the fishbowl, right?
Yes.
So the co-location project is something that was an audacious dream a few years ago. It wasn't mine. I'm not sure exactly who first conceived of it, but there's a very beautiful, large, old granite shed in downtown Montpelier. It's about 22,000 square feet, and we've had our eye on it for a while, but it was just sort of how we make it work and what programs we bring together into it. So the idea is, and there's a lot of kind of moving and shaking to make it all come together. We're going to, as they say, divest of 3 buildings that we currently have. I'll just go through those. The first is our Heaton Street building, which has held what was called CSP, but it was the Community Support Program, but we now call it Intensive Adult Mental Health Program. That we are selling that to Down Street Housing, which is super cool. They're going to be converting it into 20 or 21 apartments, and we're also selling them some land, which they're going to be moving, building 4 single-family homes on. So that's 24, 25 homes for local people to live in, and it's such a neat building. You know?
It is.
I love going in there. They're going to keep a lot of the features that are there intact. It'll still have the really neat sunroom for the residents to live in, and plenty of parking. It's going to be a really great situation for people there. So that's the first building. The other building is our CCPS building, which is outpatient services up on the Berlin Hospital campus. We've been in that building for over 50 years, and the hospital's exercising its right to take back the lease. But they're working really closely with us. They're not, they're not impatient for us to move on. They've been really gracious to let us stay there and kind of helping us work through getting into the granite shed. So those programs, outpatient, will also be moving to the granite shed. The other building that we have, or it's actually a condo, is Building C, also on CVMC campus. And that has our crisis services, intensive crisis screeners. There's some other administrative staff there. And so we'll be selling that condo to the hospital. They've had their eye on it for a while, and it helped them. They're trying to kind of pull in their satellites as well. So we'll move our crisis services down into the granite shed. Also going there, so we have the Access Hub, which has been incredibly successful. We'd like to build that out a little bit. So we've had
right on Berry Street.
Yeah, exactly. Yep. Which has been really successful, really, I think, a powerful support for people in the community. We are going to enhance that and move it. For the most part, there will still be pieces of it that will be on Berry Street, but we're going to be building a mental health urgent care, similar to what took place up in Burlington with Howard Center and the University of Vermont Health Center. And on the let me get this right. I think it's the north side of the granite shed will be sort of in a separate access into the mental health urgent care there. Right now we're looking at, we're just building plans for the inside, but 5 or 6 rooms where people can come in and get support and help there. So that'll be sort of crisis services, mental health urgent care going on in there. We'll also have some children's mental health. And then we'd like to have some, we plan to have some psychiatry and then nursing. We haven't talked specifically yet about our move to CCBHC, which is Certified Community-Based Integrated Health Center, which is a new federal designation that we've gone for. Most of the designated agencies in the state will be moving to CCBHC, and we'll be one of them. We're not sure whether or not we'll move into this designation in July or October. We're still kind of waiting to hear from the state and the feds about whether or not we move that direction. This is relevant because it's a way of integrating healthcare into the services that we provide. And then the last thing that will be at the granite shed is some substance use services. Some of the substance use services will be at WellSpace here in Barrie, but we'll be doing some group supports there. And then everyone who's working there is going to be fully trained to make sure that anyone coming in, whether they have substance use issues, whether they have mental health issues, whether they're in acute crisis, if they need, very intensive care, they'll be able to get it there. And the beautiful thing about this whole audacious plan that we have pulled together to do is that you can come in at really whatever level of need you have, or almost every level of need. We won't be providing residential services. And you'll get a warm handoff into if you need case management, if you need psychiatry, if you require nursing services. And we just think that having that close proximity for people will improve care, And the other thing that I keep emphasizing as I've been talking about this is this isn't just for Washington County folks. It isn't just for people in services with us. It's for the community. As we're coming into a period of more and more critical needs, we're seeing again and again the spike in substance use concerns and needs, the mental health issues that we're seeing certainly more prevalent around the community. This is a place where people can go and get help, and whether it's short term or long term, we just want to serve the community. And I hope by having it in a central location where people can access it, where it's it's celebrated and it's not hidden away, it's right in the center of town, we can start to push back on some of the bias or the stigma about seeking services, that this is a healthy and wholesome place to get support. And we're all going to need some help at some point in our lives, and being able to have it local and accessible is really important to me.
Yeah. So construction on this is going on like now?
Not yet. We still have to get through some permitting. Things are moving along pretty well. We have a goal of starting work in the fall, working through the winter, and hopefully, having maybe a ribbon cutting in summer, about a year from now. That's maybe a little aggressive, but we're ambitious.
Yeah.
We can dream.
Listen, we both know Vermonters don't love often change.
Sure.
So when we hear about something that's new and improved or bigger and better, that change period, I guess let's kind of bang the drum here of services are going to be actually expanded with this,
That's right.
not
That's
reduced.
Right. We're not contracting services. We're not reducing services. This is not a consolidation. It's really the square footage is actually higher than these individual buildings that we've had. We're expanding services. We're trying to make sure that the people who are working there can serve in a greater capacity and with greater accessibility. It's right on the bike path. There's sufficient parking. We've been able to secure an additional parking area that's adjacent to it. The bus station isn't too far away. There's the Gopher service that is working down there as well. So we're really just hoping that it's about access, that people can get in, get their needs met, and then get a warm handoff if they need additional support. Or if they don't, then they're back to their community doing what they need to do.
Sure. Wow. So we have crisis intervention, we have mental health, we have substance use. What else was it that you mentioned? Psychiatry
and nursing, and then it's the mental health care is for people, to be children, adults, elder care. Really, for the full lifetime that people will be able to come in and get services. We'll make sure that there's a good separation of where people access supports. We'll be considerate of what people's needs are in coming in and getting what they need.
Tell us about the Center for Counseling and Psychological Services.
Sure.
Break that down for us in ways that we can all understand what that is.
Well, so CCPS, because most of our programs have a C in them somewhere, CCPS is, like you said, Center of Counseling and Psychological Services. I always get that, get stumbled on it. It's our outpatient services. It's therapy for people to come in. There's some group work that happens there. There's some specific targeted therapy for specific needs that people have. It's a long running program that we've had, up on the Berlin campus for a long time. It has our elder care program. There are children's therapeutic supports that happen there. We have a wonderful collection of counselors there. They're just the most terrific people. They're really fun and dynamic and devoted to this work, especially now.
Starting really young.
Yes. Yep. When you go in there, it's interesting. You can see a person of any age going and accessing services. Some of the offices have some really fun projects and things for kids to work on, and
I wanna say this. First, I want to just say thank you to Washington County Mental Health for always being ready to go and help our community.
Yeah.
You proved that once again last week. We had a horrible situation, tragedy that took place in one of our local schools.
Yeah.
And out of great respect, I will be, when the time is right, be talking more about this particular story. And it may be this week, it may be next week. I've been on the phone with family and friends that are connected to this, and when the time is right, when it's appropriate to have a conversation and to allow our community to step up organically and help out and show love. We'll do that. We'll have that conversation. But in the meanwhile, Washington County mental health, I can't even imagine. And I know they're trained to do this, but still.
You can't train the courage that people have in going into these situations. And
Nope.
I'm glad you say it. It's the love, too. You know, you can't do this work if you don't love the people that you work with and the people that you work for. Last week was one of the harder weeks that I think most of the people who have worked with us have ever experienced. I won't go into detail. It's not my story to tell.
Sure.
But there was a devastating event that impacted people throughout the community in lots of different ways. And watching our clinicians and not clinicians rise to this occasion and come up with ways to go and support children in schools and adults who were just truly devastated and, kind of...
It's not just the kids. It's the whole administration.
That's right. And families.
Yeah.
And, I mean, people just brought to their knees by the sadness of this sort of devastating situation. Yes, I am... I don't know if I'll ever have the words to explain the courage and the perseverance that our staff show when
you have to be cut out for that.
Yeah. And you have to be willing to take the pain and feel it deeply, because none of us should be doing this work if we stop feeling this, and if we can compartmentalize it so much that we don't feel it deeply. And I think that's what's sometimes misunderstood about the people who do this work, is that it cuts deeply. They feel it as deeply as everyone else. It's not, you never grow a callus against loss and pain and people suffering. What you do is you have an endurance, and you have a love for support. And last week I saw this on display, the people who are up just on the front lines of this, who have personal experience with situations that are similar to this, who are still holding each other and holding the community as much as they can. And it's just the most powerfully inspiring work to see people rise and do this again and again. I'm truly, it sounds, I don't know if it sounds hollow. I don't know what it sounds like. I'm just so humbled to work with people and to be able to see this happening day in and day out. It's truly, last week was truly astonishing. And it continues to just be,
These employees of Washington County Mental Health, everywhere, these are not punch in, punch out 9 to 5 employees.
No.
They're carrying weight. They're beginning their day before they've started their day.
Right. There are no weekends. There are no evenings. Right.
No.
There's an integration of this work throughout your life, and that, I think that's not understood. I see some of of course, you see criticism of the work that we do, or, the misunderstanding of how much incredible devotion it takes to do this, and especially with, insufficient pay, unfortunately, for most of the time. I mean, that it's so heart-filled, it's so dedicated, and it is not time-bound. It's, late nights, it's weekends. I was talking to somebody on the way down here who had spent a good part of the weekend supporting families and staff around, some of the events of last week. And, there's those events, and then there's things that are unseen. We've had several situations throughout other parts of the organization that have had just tremendous loss for staff. And we have people in services who pass away, and it's so difficult, we had some specifically some people in residential services with us, and they'd been in those homes for decades, and the staff have worked there for decades, and the
They've turned into
relationships,
family.
the relationships and the power of that service and support is incredibly profoundly affecting. I went to a beautiful memorial recently for one of the residents, and the power of the love that she received in that home. You realize that it's incredible work. It's good work. It's hard work. It's heartbreaking, and this is why I feel my biggest responsibility is taking care of the staff, whether it's trying to be there emotionally or trying to make sure they have the supports they have, or advocating at the legislature and saying this it's just not sufficient pay. We cannot be trying to bring up a workforce like this that doesn't have the reimbursement that it needs. I mean,
It doesn't have works 24/7.
Exactly right, and doesn't sometimes get the recognition that it should. Sometimes I see the impatience of the community at times, wanting all things to be solved, or not necessarily understanding where our work begins and where it can't be, and how important it is to have people engaged and willing to provide to be receiving services. That's such a big part of the work that we do, and I think that's really difficult to understand.
Do you feel that those in power under the Golden Dome are really listening, really, truly listening?
I think there are a lot of people working in the Golden Dome who are there for really powerful and inspired reasons. I think that you can't do that work. I mean, that is largely volunteer work. There's a stipend, but you're devoted. You devoted their day and night. I have dear friends who have gone into the legislature and have been frustrated, I think, by some of the politics, of course, but the frustrations that come with not being able to move things forward at times. But there's some tremendously good-hearted people who really do understand and who are working very hard. There's so much need in this state. With just 650,000 people here, we have a insufficient tax base to fund all the programs that we need. Our insurance is, we don't you talk about that too much, but the healthcare issue that we're having in the state, our premiums shouldn't be twice what they are in neighboring states. Our pay shouldn't be what it is for our staff, and yet where do those dollars come from? Because we have a lot of investments that we need, and then we have problems on top of that. Substance use issues, mental health issues, homelessness. These are expensive issues. And one of the great things, I should say this about the Granite Shed, is you hear the term, I don't know if your listeners are familiar with it, but upstream services, meaning trying to fix the problem before it goes downstream and becomes even more of a problem. And this is what we're hoping is that this is an upstream fix, that this is helping prevent some of the issues that can spiral, can turn into long-term stays in psychiatric hospitals, or maybe reduce homelessness and more significant substance use issues. If we can get to those folks earlier, then we can prevent some of this. And that's part of we had some nice investment from the hospital and from the Department of Mental Health in this initiative, and I think that really speaks to the understanding that we need to be putting our dollars in prevention. And that's I see that as this work that we're doing, and also putting the dollars in the people. We have a tremendous vacancy rate in Washington County right now, which doesn't allow us to deliver the services as well as we need to. And part of that, I think, is people see this as really hard work, and maybe they don't see how powerful and wonderful it is as well. If you just see the work on the news, or if you don't fully understand what we do. I know you do some one-on-one work as well. We've had a man with autism who's lived with us for 17 years or so. I've worked in this field for 30 plus years. And, if you don't know what it's like to work, one-on-one with someone with autism or someone with mental health issues or substance use, to be able to see the beauty of life that's a little bit more fringe, it's a little more different, then you don't know that these are the kind of jobs that are really powerful for all of us to be doing.
Wow. Yeah, that was that was something. And if it wasn't for Mike Ootman, I may not have ever met that guy. And
he's a hell of a recruiter, isn't he?
Yeah, he is.
Yeah, he's a great
guy. And this young man has, I'm so blessed,
Yeah.
has
So is he.
flipped my life.
Yeah.
And forced me to think of things differently.
Yeah.
It's incredible.
Yeah.
Before we sneak out of here, real quick on the standing committees, the steering committees, look at what you guys are doing. I mean, this unbelievable. Big kudos to Penny.
Yeah, well, she's Penny's such an exciting person. Hopefully, you'll have her on here soon to talk about Peer Palooza and some of the work she's done there. But Penny has, she's working with what used to be CSP, or intensive adult mental health. But we have to have by our designation, a standing committee in our major programs. So we have to have adult mental health standing committee, we have a children's mental health standing committee, and we have a developmental services standing committee. Children's and adult mental health have been really robust. Children's becoming more engaged recently, but the adult standing committee in mental health has been very ambitious, very hardworking. We had a great meeting last week we brought in our human resources, and we're talking about our best places to work data.
Oh.
We're really looking at how to take care of our staff. We've done the survey now a couple of years. We have not been designated as one of the best places to work in Vermont. Where I came from, we were, and we're going to get there. But we have to do some soul searching, and we have to really listen to our staff and have hard conversations about, whether or not we're doing this the right way, whether or not we're hearing them. We got some heavy feedback, and so we're taking that and looking at it and trying to translate it into what we need to do. And that's what the beauty of these standing committees is. This is how we actually hear how well we're doing, right? Like, these are the people in services who we say, okay, these are the initiatives that are happening. There's so many changes that have taken place in mental health and in developmental services. There have been reforms in both of them. The role of case management has changed in both of them.
Yeah.
The role of residential has changed, certainly, in adult mental health. And having the standing committee and having people reflect back on us how well we're, these changes aren't things that we have initiated, but they're something really at the federal level that we need to change. But they can certainly tell us how well we're rolling it out, and they do. And I think we're good at seeking that input, and they're really good at giving it to us. So.
The standing committee is the second Thursday of every month.
Yes.
Over on Berry Street.
On Berry Street. Yep.
With free dinner.
That's right. That's right. Yep. Children's, I'm trying to remember what it is. And then developmental services was actually pretty intermittent. And I think that they have moved to the second Tuesday, I think. I should get back to you on that one. Of monthly. It's only required that they meet quarterly, but I think they decided to meet monthly because we want to get enough feedback.
The steering committee?
Yes.
Yes.
A standing committee. Sorry.
All right.
So a standing committee is really a steering committee. It's sort of the same thing for us.
Okay. And it's amazing. I mean, parents who have questions about and there's different subjects each time, but parents who have questions about, does my kid need an IEP? I have questions that maybe aren't being answered at the school.
Yep. Yeah, you could always reach out to
this is
any
amazing.
Any of our folks. Yeah, to get that feedback. Yeah.
Final thought: employment. If folks want to learn about career opportunities,
yes,
where do we go?
Our website is the best place, wcmhs.org. I think that's what it is.
Yeah.
And there's the careers page. There's a lot of, I would just, grab yourself a cup of coffee, sit down, look through, let your heart move you through things that, look at what interests you. talk to anybody who's worked with us, or maybe working with us now. The different divisions have different personalities, and the work is there's entry level work in every part of our organization. I came into this work. I was an artist, and I was working with another artist with autism in my studio, and had never considered this. I had actually been restoring wooden boats and doing art, and I thought that's what I was going to do. And I met this man. He came and worked in my studio with me. And
Isn't that amazing?
30 years later, this is what I'm doing, and it's a great life, being able to work with people and be inspired by them.
Wow.
Follow their lead.
Wow.
Yeah.
That sounds like this could be a book.
I don't know. I don't know if I'm allowed to talk about a lot of the things that I've experienced.
Beth, thank you so much
Appreciate
for coming
you having
in
me.
here.
Yeah.
I look forward to having some folks on soon from the Access Hub.
Yep, that'd be great.
Really want to get Penny in here too.
Yeah, for sure.
Will you help me
Yeah,
make that
absolutely. She's so much fun.
All right.
She'd be great. Yeah, and then
Great stuff.
I'd love to talk to you about some upcoming events and things. We can get Kim in here.
Yeah.
Kim Eade, our communications development director.
She's doing a great job.
Yeah, she's fabulous.
There's a lot of stuff happening.
Yeah,
And
yeah. It's
how
good
you
stuff.
guys are able to keep track of it is beyond me.
Yeah, we don't always.
You
You're
You're doing a great
There's
job.
some misses. Yeah, we're trying. We're really trying.
I love having you guys as a sponsor. I love talking about all things Washington County mental health. You guys do so much.
Appreciate your time today, JD.
We're
Thank
so
you.
blessed. Our community is so blessed. We're talking about like 10,000 Vermonters, directly or indirectly, every year
Yeah.
that have been
Yes.
affected or impacted
Yes.
by Washington County mental health. That's incredible.
Yeah.
We need you.
Powerful work.
We need you a lot.
What else are we doing that's important, right? I
Yeah.
mean, these are short lifetimes, and
Yeah.
we might as well be doing something valuable.
Folks can reach out no matter who you are, no matter where you are. You can reach out to Washington County Mental Health 24/7 and say, hey, this is weighing on me. I really need to talk. And know that you're not necessarily going to be put into the system. You can have a nice private conversation
That's right.
and just get the ball rolling and make
That's
sure you're okay.
Yeah. Yeah. Take care of yourself. Take care of your people.
Yeah. Good stuff.
Yeah.
Thank you, Beth,
Thanks
so
a lot.
much. Have a fantastic rest of your day, all right?
too.
All
You
right.
too.
Happy Monday, everyone. We'll catch you tomorrow morning. It is going to be a very, very busy week here at Aired Out. Emily McKenna, tomorrow morning from Central Vermont Home Health and Hospice will be in here to have some great conversation. Not just about their golf tournament, but about some of the work that they do as well. God bless. Have a great rest of your day. We'll catch you tomorrow here on Aired Out.